I think when we are talking to our patients about like options for treatment for postpartum depression when they've screened positive, one of the key points that we should be counseling our patients on is, that the goal is to get back to feeling like yourself. When we looked at this real world data, one of the key counseling points I took away from it for my practice is that, I can talk to my patients about the fact this is a 14-day oral treatment with fast trajectory. So you don't need to wait weeks or months to feel a difference. Most patients report a change in symptoms or a decrease in symptoms, I should say, by days 3 to 5. So many patients that I talk to in my practice, when I check in to see have they started their medication, how they're doing on their medication, I almost unanimously get the same answer is that, I'm not 100% yet, but I can see the light at the end of the tunnel. So I think that it is important to note that in this real world study that over half of participants reach remission by the time they had finished the course of the medication. That's huge, right? So as much as we love data and for things to be statistically significant, I think this is also very clinically significant for these patients who are dealing with, new motherhood or adding a child to their family because we need relief quickly for these patients. That onset of action for zuranolone is really important. I tell patients you may feel better before you even finish the 2 weeks. And that benefit tends to build rather than fade over the following weeks. So I think that's a meaningfully different conversation than when I'm talking about other antidepressant therapies and I'm telling the patient, it may be anywhere from 2 to 6 weeks before you feel a difference. So I think that's a really important a concept that we should be talking to patients about and offering them this treatment if it is appropriate.